Welcome all of you, Virtual Classes YouTube channel. In this video lecture, we will discussing about the vitamin C chemistry, biological functions, RDA value of vitamin C, and deficiency symptoms of vitamin C. Vitamin C is a water-soluble vitamins, and the vitamin C play an important role in human health and disease. Vitamin C has become most controversial vitamin in recent years because most of scientists claims and counterclaims on the use of vitamin C. Some scientists says the megadose of vitamin C can cure everything from the common cold to cancer. That's why the vitamin C is most controversial vitamin in recent year. Now we will discussing about the chemistry of vitamin C. Chemically, vitamin C is known as ascorbic acid, and the ascorbic acid, or we can say vitamin C, is a hexose derivative. Hexose means a molecule that has 6 carbon molecules and closely resemble to the monosaccharide in these structures. While the acidic property of vitamin C is due to presence of the enolic hydroxyl group in their structures, and the vitamin C act as a strong reducing agent, and the L-ascorbic acid of vitamin C is a active form, while D-ascorbic acid is a inactive form. The L-ascorbic acid undergo the oxidation to form dehydroxyascorbic acid, and this reaction is reversible. It may be changed into the by the oxidations of L-ascorbic acid to dehydroxyascorbic acid, or dehydroxyascorbic acid may be converted into the L-ascorbic acid, and both the form of L-ascorbic acid and dehydroxyascorbic acid is a active form. And the oxidation of ascorbic acid is rapid in the presence of the copper. That's why vitamin C become inactive if we prepare food in copper vessels. Now we will discussing about the biosynthesis and metabolism of vitamin C. Many animals can synthesize ascorbic acid, or we can say vitamin C, from the glucose via uronic acid pathway. However, man and other primates like guinea pigs, bats cannot synthesize the ascorbic acid because they deficient a single enzyme that name L-guanolactone oxidase. That's why man and other elements cannot synthesize the vitamin C, but some of or most of animals can synthesize the vitamin C from the glucose via uronic acid pathway. And the vitamin C is rapidly absorbed from the intestine, because we can say that we already discussed the vitamin C is a water soluble vitamin. That's why vitamin C is rapidly absorbed from the intestine. In the absorption of vitamin C, like fat soluble vitamin A, D, E, and K, chylomicron or by salts are does not require. And the vitamin C is not stored in the body because they are water solubles, and they are excreted in urine as a such, or as it metabolite like diketolic acid and oxalic acid. Now we will discussing about the biological functions of vitamin C. The vitamin C perform various biological functions, like it help in the collagen formation, it also help in bone formations, and help in the various metabolic metabolism. It help in the iron and hemoglobin metabolism, tryptophan metabolism, tyrosine metabolism, folic acid metabolism, and it also help in the synthesis of the peptide hormones and the synthesis of the corticosteroid hormones. And the vitamin C also spare the actions of the other vitamins, and it also help in the immunological functions and prevent our body from the disease. And the vitamin C also preventive actions on the cataract and also preventions of the many chorionic disease. Now we will discussing about the RDA value, that is recommended dietary allowance. The vitamin C is required 60 to 70 mg per day, but the requirement of vitamin C is increased 20 to 40% for women during pregnancy and lactations. Now we will discussing about the dietary source of vitamin C. The vitamin C, best source is citrus fruit like amla, orange, tomato, guava, and also the green vegetables like cabbage, spinach are the good source of vitamin C. And the vitamin C also present in the high concentration in the adrenal glands and the gonads. But milk is not a good source of ascorbic acid. Now we will discussing about the deficiency disease of vitamin C. If a person cannot intake a sufficient amount of vitamin C, in this person, the deficiency symptoms are appear, and the deficiency symptoms of vitamin C is scurvy. And the scurvy disease is characterized by many symptoms like spongy and sore gums, loose teeth, anemia, swollen joints, fragile blood vessels, and decreased immunocompetence and delay wound healing, osteoporosis are the some characterized of the scurvy disease. So it is a detailed discussion of vitamin C. If you like this video, please subscribe YouTube channel for upcoming video. Thank you.